Hi, everyone. This is Margaret Brennan from Face the Nation, and this is our very first Facebook Live broadcast. So thank you to whoever's tuning in here. We broadcast every Sunday, and this is a way now for us to broadcast during the week to some of you and hopefully have you participate in the kind of conversations we have with some of the most informed, authoritative voices out there. And I'm interested and excited to have our next guest join us, economist Emily Oster. She's a mom. She's someone who I know a lot of moms I know read her work to try to help us make decisions, informed decisions on the kind of risk we want to take, on our understanding and sort of digestion of all the information that's swirling out there, particularly in this era of COVID. And COVID, how it impacts our kids is so huge. Emily, thank you so much for joining us this afternoon.
Thank you. I'm excited to experiment. I'm excited to experiment with this.
Thanks. And I love the kids' artwork behind you. I've got a TV screen with the studio behind me, but
yeah, I'm bringing the, it's like a little color, a little flair,
Authentic is what I like. But I want to get into some of the work that you have been doing lately. But before I do that, I want to ask how you're feeling. I read that you recently had COVID.
I am feeling fine. I did recently have COVID, like many other people. And fortunately, I had all the vaccines and it was pretty mild and I am feeling totally better.
That's great. And did it impact your kids a lot?
No, they were fine. I mean, everybody got it, but it was, they definitely were less affected than I was. They were also fully vaccinated. So was my husband. So we sort of got the whole thing. And I think we got, we were lucky that it came post-vaccine is how I would put it.
Exactly. Well, you are lucky. And I'm glad you're feeling better. But one of the things that was big news in our household yesterday was this decision by the FDA to go to Pfizer, the vaccine maker, and say, hey, we might want to look at your data again when it comes to 2 doses of the vaccine for children ages 4 and under. That's where my kids fall. They're not eligible for a vaccine right now. And I know so many parents are kind of waiting for that date on the calendar because it impacts your psychology, it impacts your planning. And I'm wondering what you think of when you hear a data point like that the FDA might consider greenlighting 2 doses of a vaccine before they get the answer on whether 3 are required.
Yeah, I'm a little, I'd almost say a little confused. And I think that is a sentiment that a lot of people are sharing. Like on the one hand, I mean, I hear from you, but I also hear very broadly, there's just a huge amount of interest among parents of children under 5 to vaccinate their kids for many different reasons. And, not everybody wants to do that, but I think that there's a large number of people who are very eager to do that. This particular set of news, I think left people a little bit, left people confused because as far as I can tell, no new information has come out. And in December, what Pfizer said was that the response of the kids in the 2 to 4 group was not as large as they wanted to see the antibody response. So the amount of sort of antibodies they were producing in response to the vaccine wasn't what they wanted to see. So they decided to do a 3rd dose. Now, with effectively no data in on that 3rd dose, they are considering approving this. You can sort of see some reasons why they would do that. But I think it's left a lot of parents wondering, why didn't you do this before? What has prompted this now? And I'm not sure we have answers to those questions.
No, exactly. I think that's interesting because it was December 17th, the FDA said, wait, we want to see more data before we greenlight this vaccine. Because the data initially showed that the vaccine, it wasn't that it wasn't effective. It just might have required a 3rd dose to get to that comparative level of efficacy that they had seen in older.
Yeah, and it's important to remember that what we're doing here is what are called immunobridging studies. So they're not really looking for efficacy on measured outcomes like serious illness, which they did in adults, or even in infections. They're looking for, is the antibody production for these younger age groups as large as the antibody production we saw in older age groups? And so that's where they didn't see that response. But we actually don't know from what they said in December or what they said yesterday, was it like half as good? Was it a third as good? Was it almost as good? And I think that is going to influence how effective 2 doses will be. And we just don't know what that looks like.
The other thing that I think will be interesting to watch when we see more data, if we see it, is the impact of Omicron, because that's the one thing that seems to have changed in the middle of all of this. December 17th, the FDA said, oh, we can wait. Then we get hit with this incredibly transmissible variant that has impacted children and caused more pediatric hospitalizations than the prior variants had. So what does that do to influence like the kind of numbers we're going to see? Is it going to be reflective of the, the virus now?
Yeah, it could. So it could be. So one thing that is possible is it's possible that because this Omicron variant was so transmissible, that they've seen more evidence on the ground of differences in infections. So that's possible. I haven't seen much that suggests that that's true, but that could happen. I think the other, the Omicron wave kind of pushes in both directions, because at this point, by the time they meet and talk about this and decide and start vaccinating kids, we're going to be on the other side of the Omicron wave. Mm-hmm. And a lot of kids got Omicron. And fortunately, most of them were fine, because even though hospitalization numbers went up, actually the risk of hospitalization was lower. So there's a sort of like complicated calculus there. But beyond that, given that all of the many kids have had it, I think that's going to be something the FDA is going to need to grapple with as well.
Right. Because to be clear here, I mean, we're talking about medical data. You're not a doctor. You are an economist, though.
No, I am an economist. It's true.
Yes. You are somebody who looks at, data and comes to conclusions based off of that.
Yeah. And I think in this case, and in many situations, the kinds of data that we bring to this are very similar across many kinds of fields. And so that's what we're waiting for, is data out of this trial, which, we will see soon. But yes, I'm not a doctor.
But Dr. Scott Gottlieb, who is on the board of Pfizer, we should say, and joins us on Sundays. We've been talking about this, like what this would mean for the timeline for a vaccine actually being available to kids. And he is still sort of betting on March as the best case scenario, though some are saying it could come by February or end of February. What is like the practical impact, do you think, of when shots become available to the youngest Americans?
So I think the practical impact is largely psychological, which is not to say it's not important. So I think some of what is true at the moment is there are some parents for whom, maybe because they have immune compromised kids, because they're having an immune compromised older person at home, maybe because of just in general sort of how the pandemic has been, are really have sort of hung on to this or are focused on this as kind of something that will be necessary for the next step. Mm-hmm. And so I think for those parents, this is a really big deal. And this is going to make them feel really, really different than they do. I think in addition, from a policy standpoint, saying everyone is now able to be protected by a vaccine, that is going to make it much easier for some of the return to normalcy that I think has gotten a lot of attention lately, and I think is very important for protecting all the other aspects of our health, mental, physical. There needs to be some return to normalcy. I think it's been hard to think about those next steps when there's still this sort of large portion of the population that cannot be vaccinated. Once that vaccine is available, I think that will make these next steps a little bit easier for people to understand, even if only a small share of people with kids under 5 will choose to vaccinate their kids, which is what we are likely to see.
Right. That's a whole other conversation. But I know, and maybe it's because of, where I live and the people that I know, certainly there's some bias in selection there, but a lot of parents I know were excited. They were talking, I talked about it with my husband, like when we could fly again to some exotic location, when we could actually go on a vacation again and not worry about trying to keep our kids in a bubble the whole time. Because little kids in particular, they put everything in their mouth, right? There's no way to really keep them in that bubble, which is why I think so many parents have just sort of kept them home and stayed home as a result. And that's had a huge economic impact.
I think it has. And I think that beyond, there's actually been, the economic impact has gone sort of beyond that, because I think even when many parents got a little bit more comfortable and sort of heard a little bit more of the message of, actually, this is a very low risk group. And then in many cases, in the case of Omicron, people got Omicron, and then, you know, they kind of felt like they were sort of on the other side of that. We're still seeing a lot of these economic impacts because of the disruptions for parents,
yes.
right? Not just the getting the COVID, it's the quarantining because of the possibility of getting the COVID. And that's been really tough for this under 5 group, because as we've moved forward on the K-12, on test to stay and kind of lowering some quarantine requirements there and so on, that hasn't happened much in childcare. And I think for parents, it's just been kind of devastating.
No, it has. And that's a huge key point in terms of just the disruptions with not knowing if you can drop your child at school or daycare, you know, for an unlimited period of time.
No, and for parents, you know, to sort of come in, almost the uncertainty is almost worse than knowing that there isn't child, right? If you just said, you know, we're not having childcare anymore, it's a new policy, no childcare, you know, that would be very bad on a lot of dimensions. But, you know, people would say, okay, what's a sustainable way to move forward in that world? This thing of my kid is enrolled in childcare and I pay for sort of full-time childcare, but between, you know, December 4th and January 20th, I got 3 days. Right. That's not really childcare. That's just like scrambling every single day.
Right. And their kid might have been healthy the entire time, but there was an exposure and the policy yes. I mean, so many parents are still stuck in this pandemic, which is why when we had Dr. Gottlieb on Sunday, I asked him the question of this vaccine for the youngest Americans, whether it unlocks part of the economy once we get it. I want to hear what you think of his answer.
I don't think it unlocks everything else for a couple of reasons. Number one, we're seeing a lot of parents with young kids aren't getting their kids vaccinated. Only about 25% of kids 5 to 11 have been vaccinated. It's been very disappointing. About 18% have been fully vaccinated. So I suspect that there's going to be some hesitation with the youngest kids as well. We can't fully explain it. Also, while the vaccines prevent infection, so if a fully boosted adult has probably a 50% lower chance of getting infected in the first place with that vaccine, they're not 90% protective. And probably in the younger kids, they're going to be a little less protective against infection. So you're still going to see kids be able to get infected even if they're vaccinated.
So I mean, basically what he's sketching out there says, well, the only way life would truly change is if we start changing the health restrictions and, you know, adjusting to what we are going to tolerate when it comes to keeping childcare open.
Yeah, I think that's right. And I think that in some ways, I think what he is saying is really important because it gets us to a place of realism. I think that if we are sort of waiting for vaccines on the idea that, like, well, as soon as we have availability of vaccines, you know, everything is going to be open and no one will have COVID anymore. I think we've made that mistake actually a bunch of times. I think we made it early on. I think we made it to some extent with kids sort of expecting that that the vaccines, which are unbelievable and have been like sort of completely game changing in terms of serious illness and death and all these other things, particularly in older people, like that's super important. But actually moving forward as an economy or just as a society is going to require relaxing protocols, even accepting that some people who are vaccinated are going to get COVID. And I think we're going to need to move to something that's closer to how we dealt with other illnesses in this age group, which is stay home when you're sick. You know, if you got a 24-hour rule or maybe it's a 48-hour rule now or something like that after you're sick, but without treating it like this thing where it's, 10 days of a classroom closure because somebody had an asymptomatic, surveillance test.
Right. But I guess for parents, what is their next step on those isolation protocols and the quarantine protocols? I mean, does that mean they should be pressuring their daycare centers to adjust? Does that mean they have to look at the local infection rate and do the math to figure out the odds of, where things are? I feel like there's still a lot that's a little murky in terms of what the best practices are.
So I think, first of all, I think we really want to separate a little bit. There are a lot of parts of the country where where sort of childcare is operating more or less normally without these kind of as significant disruptions. And so some of this is sort of just there's differences in how people think about this. I think it is the now kind of the job of the CDC to try to update some of these protocols. And I think they will get an opportunity. There's an opportunity to do that if these vaccines move forward, to say, okay, now that we have vaccines available for this age group, we can move to a sort of like out of a wartime footing, to take the sort of phrasing from the UK, out of a wartime footing here into a sort of more like, let's treat this more normally. But I do think we need the CDC to make that move. One of the things that's been frustrating for me personally is I think the CDC has been sort of quite poor in their messaging and has not sort of has not always thought through like, okay, there's actually a lot of things going on that we want to consider. And it's not the only thing that is kind of on the table.
No, and we've seen that show up in our CBS polling data that like across party lines, there's just frustration with the lack of clarity on messaging. I want to ask you about something the White House did try to articulate this week, I think, and clearly lower expectations on, and that's the jobs number. Yeah. Take a listen to how the White House acknowledged the impact of COVID.
Because Omicron was so highly transmissible, nearly 9 million people called out sick in early January when the jobs data was being collected. So during that same period of time, and the week the survey was taken, the week of January 12th, was at the height of the Omicron spike. So we just wanted to kind of prepare, people to understand how the data is taken, what they're looking at, and what it is an assessment of. And as a result, the month's jobs report may show job losses in large part because workers were out sick from Omicron at the point when it was peaking during the period when the week where the data was taken.
Yeah. So that's saying brace yourself. Right?
Brace yourself. This is not going to look great. Yeah, I think that's right. The job numbers are not likely to look good. And I think there's one piece of that, which is what she's saying, which is, these are samples and they're taken at a particular time and so on. I think that it is true, however, that this, jobs recovery has not been what people had hoped in a lot of cases. And I think there is a part of that is not this kind of transient, I'm out sick with Omicron, but the feeling of like, things are not back to normal. Things are not, I am not in a position where I can predict what it's going to look like in a month. And so for example, parents, like the idea of like, okay, now I'm ready to re-enter the labor force. It's not clear that everyone's there yet. And I think that is a real thing. And I think that's something that the White House probably does need to grapple with. How do we really think about a return to normalcy, and how does that relate to the economy?
Right. And it's interesting with this new variant, the predictions that it could not necessarily spike numbers, but just extend the infection tail, as Dr. Gottlieb put it.
Yeah.
So take that into calculation for the next few months, I guess.
I think that's right. My guess is that we are going to move away from such a extensive focus on cases, which is probably the correct metric, at least for calculating the pandemic. But in terms of, are people out sick, if that's, to the extent that that's playing a role, then, that is going to continue. I think we can be in a position where we can start sort of returning to more normalcy, given the sort of this side of the wave of Omicron, but we shouldn't expect that there's no COVID anymore, because we're sort of never moving to a world where there's no COVID.
One of the
sorry.
I know.
It's hard to hear,
One of the things, though, I know you've spent time thinking about, and we talk about it, but it's so hard to quantify in a real sense, is the mental health impact. We know it is there. We know it is with all of us, the adults, and we know it's impacting kids. And we don't know how long this lasts for either, right? Like the cumulative toll of the past few years on children and their development. When do you think we will have an appreciation for that?
In about 35 years. I mean, I think we will learn over the next couple of years quite a lot more about sort of what have the trends look like in things like mental health diagnoses, in different metrics of the impacts on kids. I think there's an extent to which probably some of that is going to have to just wait a very long time for us to sort of fully realize some of these impacts. And, there will be some positive impacts probably, and a lot of negative impacts. And unfortunately, some of what I think we're going to have to try to learn is, what are the things that we can do to make those better? What are the ways in which we can kind of step in to try to improve try to make kids' mental health better, to sort of help them readapt to some sense of normalcy. And I think that people say kids are resilient, and kids are resilient, but I think as almost any parent, there's kind of, it's clear that kids are thinking about this, that they've got it on their mind. And I think we're going to have to grapple with that.
Right. I know we were having a conversation recently with parents about that, of So when do you start telling your child they don't have to wear the mask and that they still are safe when they're not wearing the mask? And, you know, mentally what that means for them when they've only gone to school, seeing other little kids and not being able to see their mouth when they speak developmentally.
Yeah. And how do you sort of make it clear to them that, like, you know, they're not going to kill their art teacher? And that's, you know, that's not on them, and that's not their responsibility.
Right. They're hard to communicate to small children, all of this. But when you look at the research you've done on the impact of the year and a half, 2 years almost of hybrid learning or virtual learning that our country went through, you've made the argument that, like, this needs to be a data point in how we respond to the next pandemic and the next health crisis.
Yeah. So I think what we've seen in the data is that this sort of virtual learning, hybrid learning was not effective, or not as effective as in-person learning, that the test score losses are large in general. They're much larger in places that were that had less in-person learning, that the effects, the sort of negative effects of virtual learning are largest for the groups that are most vulnerable, for Black students, Hispanic students, students who are in the places where there's more eligibility for free and reduced price lunch. So we're seeing sort of simultaneously those groups are less likely to have access to in-person schooling and are hurt more by not having it. And that has continued. So I think one thing to note is that if we look at, like, whose schools were closed in January 2022, it was also the places that were closed in 2021 and the places that are serving more vulnerable students, even though it's not particularly the case that those places had more COVID. In this month. So we're really sort of continuing to see the pandemic exacerbate pre-existing in educational inequality. And I think that that's something that that is really, really crucial to sort of think about. This kind of what people call a K-shaped recovery is happening in education, just like it's happening in other areas of the economy.
And basically adjusting the educational system to be able to account for that. I mean, standardized testing or expectations that we're putting upon our kids. Like, how long do we have to adjust for that?
So I'm not sure I would adjust that, because I think that that's really important for measuring and for understanding the impacts. So I think the adjustments that I would point to are things like tutoring. Like, we know that, you know, one-on-one tutoring works. There's a lot of money getting sent to school districts. They need to be using it in ways that are effective, and, you know, ways that evidence has shown are effective, and whether that's tutoring or other kinds of educational investments. You know, but I think that's where I would focus, not not to say don't test, not to say don't find out about this problem, but to say, okay, let's try to fix it.
Right. But, you know, there is a movement saying, you know,
I know, but I don't agree with that. Let me say,
yeah,
I don't agree with that.
No, I think because you want to be able to measure it.
Because I want to be able to measure it. Yeah. I mean, and I think that it's, you know, it's important to understand, where are we doing a good job recovering? If we never measure this, then we're not going to know where we're doing a good job recovering. We're not going to know what kind of tutoring is good, or what kind of other interventions are effective in fixing these problems, which, by the way, are not unique to the pandemic. You know, we had educational inequality before the pandemic. This made it more visible. Maybe it's an opportunity to figure out how we can fix it.
So what is the thing that you want to sort of bottom line here? I mean, what is the cost, you think, of this pandemic to the economy? I mean, are we just constantly going to be seeing the virus determining the path of the economy for the rest of this year?
I think it will, you know, I think we will start to see more normalcy in the spring. And I think that will, you know, that will kind of rev up the economy again. I think we'll start seeing more return. My guess is these job numbers will improve. I think for me, some of the uncertainty lies in the fact this is basically a seasonal virus. And so, you know, we're likely to see in the fall, winter of next year that we're seeing some COVID. Right. And I hope that we are going to be prepared to think about how we can sort of live with it in a real sense. That means that somewhere between, like, pretending it doesn't exist, which would not be a good idea, and sort of reorganizing an entire society around this, which I think is also a mistake.
Emily, always good to talk to you. Always enjoy your newsletters as well.
Thanks. Nice to talk to you.
And thanks for joining us for our first Facebook Live. It was a fun experiment. And for all of you watching now, we hope you watch Sunday. We're going to have a focus group with some parents dealing with some of these challenges right now with kids across all different age groups and still living and experiencing this pandemic. We're going to talk about all of it, and we hope you'll join us for that and tune in Sunday for more Face the Nation.